Ladies and gentlemen, good morning, good afternoon. Welcome to our Q2 presentation of the numbers of Remedent and our presentation about our company. Our key focus items have been in the past year, or years actually I should say, is to clear up our balance sheet and to make sure that we align ourselves or that we reinvent ourselves from a heavy logistic product to a more streamlined, more digital operation. And I think it's exactly what we've been doing. We have realigned ourselves to take advantage of what we call digital dentistry 2.0 by using all the experiences we have gathered over the years and our position as a market leader in cosmetic dentistry. But first things first, let's talk a little bit about the numbers. Our Q2 2014 compared to the same quarter last year. In sales, we did a little bit better, 853,000 versus 766,000, with a gross profit of about 615,000 versus 512,000, which gives us a net income this year, Q2 2014, of $83,000 versus a loss of about $11,000 last year. This is completely in line with the expectations, and keeping in mind that this is the summer quarter where most of our offices and our customers were closed either in July or August. Okay, let's move on to the balance sheet. The balance sheet, we see cash of $121,000 versus $23,000 last year. Accounts receivables about $1 million versus $761,000. Our Glamsmall Asia plus the money due to us is about $2.5 million versus $2.6 million. Our investment in MFI has changed a little bit from $787 to $958. Accounts payable went down to $795 from $1,028,000 last year. Best news of the day is that Q2 2013 we still showed a line of credit payable of $671,963 versus no line of credit payable at this point. Now for the year, profit and loss for the year, that brings us to sales about $1,781,000 versus $1,466,000 last year, with a gross profit of $1,213,000 versus $968,000 last year, gives us an income for this year of $155,000 versus $41,000 last year. As I said, the credit line is completely gone, and we virtually have no more bank debt. Very importantly, on all of our minds, mine first of all, we have reached an agreement with our lender, I should say, Excelsior, whereby we repay half money that we have, actually, half of the debt with cash, and half will be transformed into a prepayment for our new products, which I think is phenomenal news. This is pending a board approval on the part of Excelsior board, which is going to be meeting, I believe, on the 21st of this month. So I expect to be able to announce you very, very soon. Let me talk to you a little bit about our future. Normally I start with China, I will end up with China at this time. But let me talk to you a little bit about digital dentistry 2.0. The dental industry today is undergoing massive digital reorganization on all fronts and everywhere in the world, including the developing world, including China, is changing digital. From practice management softwares who run everything today, from scheduling appointments to insurance claim processing to productivity and accounting statistics. Besides the side of what we call practice management, which have been a key development factor in the past years, we see another side of digitalization in the office, which potentially has an even bigger impact, is the digital changing of the workflow. We have seen, and very much in the last years, a huge amount of consolidation within the labs. Labs are getting together, labs either are closing down or being gobbled up by larger labs, and investing very, very heavily in the digital workflow in digital production. It's exactly also going on a global basis. No longer can they afford to have a lot of manual labor. Everything is going digital. In that specific workflow, what is missing in most cases today is the digital impression. Digital impression happens today at lab level, whereby manual impressions are being scanned by desktop scanners in the lab, then to put them into the digital workflow, into the digital production chain. This chain can actually no longer start at the lab level, but need to start at the chair level with the dentist. Intraoral scanners will be at every chair and at every level of the starting of treatment. This is 100% my belief, and yes, I think a lot of people have made comments on this, but we believe that the first handshake will be a scanned image. As we have talked in the past, the Condor scanner, being the first scanner of the second generation, will surely attribute a great deal to make intraoral scanning available at every level and for every dentist. Three-factor, price, size, and color being the three major advantages of the scanner. Remedent, through its ownership and privilege relationship, as you all know, stands to benefit from both the Condor as well as the general acceptance of intraoral scanners by the industry. Not only Condor, but scanners in general. At Remedent, we have pioneered and advocated not only the use of an intraoral scanner at the start of the digital production chain, but for the scanner to be the initial handshake with the patient. In our philosophy, he who controls this handshake will also have the first impression and is perfectly positioned to take it from that first impression to the control of the flow of the patient by guiding him, by consulting him, by selling him treatments, to actually delivering the treatments later on. So our philosophy, thanks to the scanner, who is totally different technology of what's available in the market, we will have the chance to bring the scanner to the front of the chain, not having the lab doing the scanning of the impression, but actually doing the scanning of the mouth directly in the patient office. We've talked many times before about all the advantages of doing this, time savings, precision savings, no more DHL or FedEx cars driving around with the impression, the fact that the impression can be stored digitally, all of those advantages, of course, they hold true for us, they hold true for the competition as well. But we believe we are perfectly positioned to take advantage of where this industry is going. To that effect and respect, we have been working very, very hard in the past years to come up with software solutions using our experiences in the industry to be sure that by the time the scanner gets shipped in the North American and the global markets that we are ready. So I'd like to move to the next slide and show you what I believe will be the practice of the future. So if we look at this diagram here, I'd like to immediately go to, okay, we're going to be scanning. In countries where legal requirements are there that the dentist needs to do the scan, in other more liberal areas, including the United States, I believe a hygienist or an assistant, other staff members can do this scan. In our opinion, the scan is going to be done by the dentist or by the staff with every patient prior for her or him to see the dentist. So we're going to start from this scanned image, a virtual patient, if you like. So we focus a lot on this image, and as I do my presentation, you'll understand why. Then I go to Smiley, which is all of these three programs, by the way, that we're going to be discussing on Remedent products. The Smile Me, no, we'll show it to you a little bit later, so you can see we have a Smile Me and an advanced Smile Me. We started to ship it real well. And the Smile Me is basically get to know your patient. Definitely in the case of a new patient, it is very important, but even existing patients who have no idea what the dentist actually can do for them. Yes, they know they go there for treatments, they know they go there for hygiene, but they didn't know necessarily that you can get a beautiful smile there or that he can straighten your teeth using Invisalign or other stuff. So with the Smile Me, which is a very fast simulation tool and an education tool, we can do a number of things. We have a phenomenal developed, our core business is veneers, as you know, and we've developed the most unique database, the largest database in the world of different veneers sizes and shapes. So by using the scanned image of the condo or any other scanner for that matter, you can automatically have the software detect the perfect matching veneers. Once both patient and dentist are convinced of this, this actually becomes a file. As we have a 3D file of this veneer, this can now go directly to either the inventory of the dentist who has that veneer, in the case of Remedent in stock, or in the case of Glam Smile, a customized veneers can be milled by a lab. So this starts with the Smile Me. We get to know the patient. Then we move to a very impressive new software, which I'm very proud to announce that will, before the IDS of next year in 2015, we'll be shipping this worldwide. It's a PAN platform, works on everything from Android to iOS to Windows to Linux. And it works with a lot of input sources. The input sources could be an intraoral camera, could be our scanner, it could be a CT scan, it could be digital X-ray. And I will show the product in a little bit more detail in a demo later on, but you'll see that this product will help to do three things basically. It's going to give allows the dentist to diagnose along with the patient. Because what's going to happen right now is that you're going to be looking together with your patient to a 3D perfect image of your mouth. So anything that you can see and understand is more likely to get accepted. I add in there 1 golden minute. This is based on the experience that we have in our own practices, is that what happens if before you get to see the patient, before you take out that little mirror, before you take your diagnostic skills to the patient, what happens if the dentist right now on her iPad, on her computer, on her iPhone, iPhone 6, if she could already see 1 minute ahead of time what she's about to experience with the patient. Imagine that you went in for an examination at university, and you would give this minute, 1 golden minute, where you already have the questions, where you could start thinking about how you're going to present this, how you're going to do this. This 1 minute is a golden minute. And I call it a minute, could be 2 minutes, whatever you want to be, 30 seconds. But what we say is that now the patient moves to the chair, the dentist already saw in 3D, completely visuals of the mouth he's about to examine, preparing how he's going to deal with this patient. Once that is done, we're going to do the co-diagnostic. The co-diagnostic could also read the specialist be, could be the lab. We can invite them by a simple click. We could invite another team member to co-view. In the case of a large chain of dentistry, you could bring in the help of the clinical director in case of doubt, or you can get the insurance company to view it with you to give a quick okay. Of course, afterwards, sometimes you still need a tactile confirmation of certain stuff that you've seen. From that diagnostics, automatically and immediately, as this is a drag down, you'll see it in the demo, we go to a treatment plan. And the treatment plan is basically what we have done is we've taken the issues, we've taken the recommendation on the solutions, and the software automatically took care of all this, put a price into it, and we now have an automatic treatment plan. No more assistant who needs to type out, no more assistant who needs to take notes. And from there we go to the workflow. It may need another scan because you have now prepared the teeth or not. From the impression scan, we go into the digital workflow. We're going to send it to their trusted lab, and from there on, it's no longer responsibility. Or it could be sent to services that we co-control or control, where, for example, in the case of veneers, we can do the design for the veneers and charge for the veneers, etc. Okay. So that's the number 2, drag and drop diagnostics. I have a lot of hopes for this product, and this is a PAN platform product, and it's a PAN scanner platform, a PAN image source platform. This can go places. Next on the agenda is our exam. Our exam is basically what we are able to do for tooth, we can do for soft tissue, for all the soft tissues in the mouth. So the first thing that always comes to mind is oral cancer, and yes, shockingly amount of numbers of deaths in worldwide are attributed to non-diagnosed oral cancers. And the reason why it's non-diagnosed is because it's not really visible to the naked eye, and then when it is, it's most of the case it's already in a well-developed stage. If we look at using a 3D scan along with special dedicated light, we now can potentially see areas of concern that could enlighten us and that could tell us that potentially special care is needed. As we move more and more from sick care to health care, which is try not to make the cost, but try to prevent the cost, this is definitely a program that will have a lot of attention by a lot of both governments and insurance companies, and a large number of change are adapting this strategy. The OR exam could be a reimbursement or copay, and obviously there's a lot of other stuff that can come out of it. We can see gingival retraction, we can see a lot of stuff in the soft tissue area, which is mostly to do with oral hygiene. So a number of players, mouthwash players, anybody could be partnering with us and actually taking the scanner, and I'll get back to that later, but we could take the scanner outside of the dental office as a prevention tool and take it on the road, take it to pharmacies, take it to nursing homes, take it to everywhere where special attention is needed. So let me move to showing you those 3 products and start with Smile Me and the Advanced Smile Me, followed by the drop-down diagnostics, in addition to the OR exam. So now what we're going to see, that dental scanning may go a lot further than just the dental office. Prevention programs, schools, pharmacies, you name it. Let's take a look at a file. Let's take a look at a 3D file and see for yourself what an enormous possibilities a dentist or any health worker could have in terms of viewing, even if the patient is no longer available, is no longer in the facility. So our positioning in Digital Dentistry 2.0 is focused on the start of the chain. We call it the handshake. But important to understand is, as Remedent, we are kind of engaged to Condor. We have a lot to thank Condor for, but we are not Condor, which means that we will co-market digital solutions with the Condor, but we will be platform independent, and we will be cloud-based. I believe in today's environment, the digital image file becomes more and more important as treatment planning, co-diagnostic, insurance claim processing, and maybe also liability protection. Let me focus on this a little bit. Liability protection, which means is that when we talk to dentists, a lot of the times they say, well, we've done this beautiful work and we had this perfect adaptation on the gingiva, and the work was perfect. And 2 years later, the patient goes back and there's leakage or there's problems. Well, the dentist knows that most of the time this may actually be due to external factors and more likely than not, poor hygiene on the part of the patient. Now, the patient, he doesn't look at it this way. He thinks that the dentist originally did not a very good job. So in today's age and world, the dentist wants to be protected from this. And in one of the items that have come out from the test pilots, the pilot dentists that worked with the product, is they would like to do a scan after the work is done. Not only to brag about how beautiful the work is, but actually to show and validate by the scanning technology that the work was done perfectly at the time when the patient leaves the office. So if claims later come up, at least he has proof that he has done a perfect job. We will have our solutions are not exclusive to the Condor. All our present and future scanners will benefit from it, and a host of images, 2D, 3D, coming from iOS, desktop scanners, cone beams, X-ray images, all can benefit from diagnostic tools, as well as from cloud-based saving tools. So next to the software, obviously, there's a lot of services, designing veneers and stuff that we can do partnerships with, which we are exploring. To my great satisfaction, we received the biggest people of the world, the dental world at least, to come and visit us, looking at our technologies and dreaming up ways for us to collaborate with them, which I believe could make 2015 truly a pivot year for us, and it could truly bring us into the digital age and bring Remedent to the place where it deserves to be. But we are still in the veneer business today, and I'm happy to report that China continues to do well. Let me talk a little bit about China. We just recently, and I'll show you some pictures later, have opened Wuhan in the past quarter. We continue to grow in China and remain very committed to the future and to further expand our efforts. The luxury slowdown that is currently happening in China, mostly to do with the new government policy on spending by public or government officials, and namely the way they spend on luxury, does not seem to apply too much to our business. Our business has been able to keep up pretty well, and we expect it to do well in the future. I actually believe, and I continue to believe, it's not the first time I say this, but I believe that dentistry in China will be the driver for global dental growth. China still needs to train about 1 million dentists in order to be at par with the Western world. Average spending by the Chinese consumer or patient is less than $5 per year. If you compare this to about $300 per year per person in Europe. The concept of a private dentist is very new to the Chinese people. Most Chinese, they will show up at university, take a ticket, and wait their turn and get assigned one of the 200 or 300 dentists that are available in the university. We believe that will change, and it is changing every day. And I believe that we are very much perfectly positioned to take care of the upper niche of this market. And it's the upper niche who's going to be the first ones to go and have a request for their own private dentist and will go to the private practices where the dentistry level or the level of dentistry and services provided are more at par as to what they expect. Our team in China is focusing today a lot on to increase traffic in existing stores. Currently, our top 5 is Beijing, Hong Kong, Shanghai, Guangzhou, and Wuhan. Wuhan is the newest one. Guangzhou, Shanghai is starting to do really well. I'm very impressed with Guangzhou. Actually, it takes about a year to 1.5 years before they really start to ramp up. And every time again, I get a little nervous because I expect this to be like, I guess, like another store where you just open up and people line up to buy your foods or clothes. It's not the case. We have to build it. But it builds nicely, and once it is built, it continues to work. What we have experienced is that if you look at the map of China a little bit, with the presence of our studios in Hong Kong, over Guangzhou to Shanghai, Beijing, we definitely have a store or studio in the best cities and in the luxury line cities, all in one line. And what we have found is that although that our clientele doesn't necessarily come from those cities, they come from those cities, but also they come from all over China. And the reason for that is that we are obviously working with a very affluent, we still are a fairly expensive service in that country. We work with a very affluent clientele, and that affluent clientele travels. Actually, the proof of the pudding in what I've just said is the fact that our best lead generation program today, where we get most of our customers from, our patients from, is exactly from travel. In our marketing, in airline magazines is the number one lead generation for our studio. So we believe that with the decision to focus on increasing, and all of our studios are large, they can handle 2, 3, 4 times the amount of business they're generating currently. We're going to be focusing a lot on increasing the marketing to drive the people to those stores. Okay. So basically, all good, all very good. Let me give you some timelines of things to happen in the next months and quarters. We're showing our new softwares for the first time, drag and drop software at the ADF, which is the French show in Paris next week. Starting, I believe, on Wednesday. In Europe, staying in Europe, in Cologne is the largest dental show in the world. IDS happens every 2 years and happens next year in March. Yes, we're going to be showing fully developed the suite of softwares of Remedent in both the cosmetic and the diagnostic areas. US. We're going to be early December at the Greater New York. For the time being, we're scheduled to have private distributor meetings, as we are in application for FDA, and not having an FDA yet doesn't allow us to quote prices or to promise shipping dates, but FDA is truly imminent, and we believe we'll be ready by the next big show, which is actually a much bigger show than the New York show. The most important show in U.S. is in Chicago in the month of February. So this is, I believe, all very exciting. It's we had to do it with little resources and a lot of creativity, but I think we managed well. We have a lot of thanks to partners who've been very patient with us and helped us to not only to survive but to thrive. I'm very hot about our affiliation with the Condor. There was delays by the Condor. I think the delay will be almost have been 1 year. Good and bad. The bad is that we could have sold a lot of softwares, but the good thing is our softwares were ready and now they're ready. So all in all, I can look at this delay as a positive point, and that we can take care of this excitement that surrounds this digital workplace, and the scanner as the start of the chain. It's going to be a lot of battles ahead, battles of convincing and contradictory views from other people who believe the scanner should be at the endpoint. We believe it's at the front, but that's okay. Those are the kind of battles we like to engage in. We have only one way to go, that's to win these. And I think this concludes our presentation for today. Thank you very much for watching. Give it another couple of quarters, and I think I think we can surprise everybody.